so I'm Tori. It's so nice to meet all of you. I am an assistant professor of psychology at Portland State University, but I'm also affiliated with the Oregon Healthy Workforce Center. And before I move on, I also just wanted to acknowledge funding. So I'm going to be presenting some research today that was funded by the Department of Defense. But additionally, multiple of the students and the faculty that are on these projects have been a part of the Center for Health, Work, and Environment, where Natalie is, and the MAP ERC in Colorado, and then also the Oregon Healthy Workforce Center and our Occupational Health Psychology Training Program grant at Portland State University. So just wanted to acknowledge both the DoD and NIOSH for funding this important work. So yes, as we've talked about throughout the day and especially earlier this morning, workplace stress is at an all-time high. I'm going to be reporting some results from the American Psychological Association that Dr. Chosewood also touched on this morning. But one of the things we're seeing is that 64% of employed adults report work as a major source of stress in their lives. 56% say that job stability is a source of stress for them. A large majority, 68%, report that their job has been negatively impacted by the pandemic. And if you ask workers what are the ways that their job or their employment has been affected, about 19% say they've had hours cut. 14% have had to balance household responsibilities during work time. And we know that there's been significant effects, especially on working mothers during the pandemic. And then additionally, about 14% say that they were either laid off or experienced some sort of decreased productivity. And as Dr. Chosewood mentioned this morning, all of these results have been really enhanced and facilitated for essential workers who are facing increasing workplace sources of stress. Now, what else is happening psychologically? Well, I think it was so great that we've been able to talk about, some of these trends around the Great Resignation. And then additionally, what's been talked about a little bit less today, but I think is really worth noting, is also increasing reports and increasing focus on racial ethnic discrimination within workplaces, and just an increasing need for greater focus on diversity, equity, and inclusion within the workplace. And so I think as someone who has a background in occupational health psychology and organizational psychology, there's this big need for us to address these total worker health concepts more than ever before. So first of all, more of a focus needed around stress prevention. I think alongside these trends around mass numbers of workers leaving the workforce, I think we have a real need to focus more on meaningful work and how to create meaningful work environments and meaningful roles for employees. I think the more we can do to increase supportiveness within organizations is really important. Dr. Schwatka's work, I think, is so critical for this, and especially with a focus on leaders. And then work-life programs, as was also mentioned this morning. I'm going to be focusing a little bit more on work-life, work-family interventions in the latter part of this presentation. But I also wanted to mention workforce training and development. I think as we're seeing both increasing experiences of harassment and discrimination alongside people leaving the workforce and engaging in these career changes, the more that we can enhance opportunities for growth and development for employees, the better. I think that's a great way to recruit and retain employees into good working situations. And then lastly, just as I've mentioned, I think occupational health psychologists are particularly interested right now in assisting with efforts related to diversity, equity, and inclusion, and trying to decrease and minimize experiences of mistreatment within the workplace. So that being said, I wanted to draw your attention to one specific factor that I'm going to be focusing on today, which is sleep. And I think sleep is highly interconnected with experiences of strain, both in the workplace and at home, and also experiences of fatigue. And so sleep is one concept within a larger total worker health approach that I think can have lasting impacts on a lot of different important health and safety and well-being outcomes. So, for example, we know that a lack of sleep is related to increases in strain and vice versa. And fatigue is also associated within these cyclical relations as well. And so the less sleep that we get and the poorer sleep that we get in terms of quality, we know this has been associated with decreases in positive safety behaviors. We know that it's been associated with increases in accidents and injuries in the workplace. Additionally, we know, especially right now, this is so important, a lack of sleep or deficient sleep has been associated with decreases in immune function and short-term illness, which has implications for COVID rates right now. And then we know that there are long-term chronic illness outcomes associated with not getting enough sleep. So these include increases in cardiovascular disease, cancer, diabetes, and even all-cause mortality. And then lastly, work performance is also hampered when employees aren't sleeping enough, and when workplaces aren't creating environments where enough sleep can be obtained. So that being said, I wanted to give you just some quick statistics on sleep and what sleep looks like in our country. Now, we know that about a third of adults do not get enough sleep, and 7 hours has really been determined to be sort of the minimum threshold at which, if employees are getting less than that or individuals are getting less than those 7 hours, this is when we start to see cognitive deficits, behavioral deficits, and also decreases in physiological functioning. A third of all individuals report insomnia symptoms. So insomnia being difficulty initiating sleep or maintaining sleep throughout the night. And estimates suggest anywhere from 17 to 13% of all workplace accidents have some sort of sleep problems involved with them. And it's been estimated that this has resulted in a loss of $31 billion annually in our country. We also know from some research that short sleepers lose approximately 6 work days a year in productivity. So they're there and they're present, but they're not as productive as they would be otherwise. And estimates range from $280 to $411 billion annually. Now, one thing to note is that these data are from before the pandemic, and I think we're still understanding what sleep is looking like right now. And there are some complex and interesting effects on sleep during the pandemic. I think one thing that we found is for a lot of workers, they're no longer commuting. And so that's always been a major life activity that's been exchanged for sleep. So in that way, workers have been able to get more sleep. Yet in other instances, of course, the stress of the pandemic has resulted in decreases in sleep quantity and quality. And then additionally, we know that workers are more and more having to integrate their work and non-work life, as Dr. Chosewood talked about earlier this morning. And that also has significant implications for how much people are sleeping. So, some estimates suggest that prior to the pandemic, about 10% of people had met the criteria for clinically based insomnia. And some of the estimates that are coming out now, as we're within the pandemic, suggest that that number or that rate has actually doubled to something more around 20% of all people are meeting the clinical criteria for insomnia. So I think there's a lot more research here to be done. And again, we're still learning as data come out, how people are sleeping right now, and just the different and interesting ways that sleep is being positively and negatively affected. So now that I've given you a little bit of a background around sleep, I wanted to transition and share with you some initial results from a total worker health intervention that we've been working on over the last 4 years. And I want to acknowledge my colleagues, Leslie Hammer, who's both at Portland State University and at Oregon Health and Science University, and at the Oregon Institute for Occupational Health Science. Leslie's the PI of this project, alongside myself and Cynthia Moore, who's at Portland State. And then we have a number of individuals, both from the Department of Defense, OHSU, and Portland State, who have been working hard on this. And so I'm just going to share with you some preliminary results that we have looking at whether this total worker health intervention has a positive effect on sleep. So as a little bit of background, workplace sleep interventions to date have kind of taken one of two paths. So many interventions have looked at protecting or improving the sleep of employees by altering aspects of the work environment. So specifically, things like changing job demands or trying to address better work schedules. And then in a different vein of research, much separately, has been this more individual level approach where scholars have tried to improve sleep through intervention tactics like increasing mindfulness, engaging in cognitive behavioral therapy with participants, or trying to train and educate workers on sleep hygiene. But the really interesting thing is that the total worker health principle around integration has really not been seen to date in the sleep intervention literature that's occurring in workplaces. And so there's really a need to integrate health protection techniques with health promotion techniques and taking more of this holistic total worker health approach. And so that's what we really tried to do in this study, was to yoke together and integrate together a higher organizational level health protection intervention component with more of an employee-focused, employee-level health promotion component that I'll explain more in a minute. But I think it's important to note just that to date, a total worker health approach has really not been seen in any of the sleep intervention literature. The other thing that I think is important to note is that previous research suggests that sleep is intimately tied with, of course, both work life, but also non-work life, family life, our engagement in community. And so future interventions should really target stressors in both domains. And again, the workplace sleep intervention literature to date has really more focused just on what's happening in the workplace, or sometimes what's happening at home, as a means to improve sleep and prevent sleep deficiency. So one of the things we tried to do in this study is to not only integrate health protection with health promotion, but also to focus on both work life and non-work life in what is more of a true total worker health approach. So we conducted a rigorous randomized control trial to improve employee sleep within a military sample. We were actually working with the Oregon National Guard. I'll talk more about that in a minute. And we were drawing on the total worker health approach to integrate health protection and health promotion at both work and home. And I want to just give you a preview of what the study design looked like. So we were working with the Oregon National Guard, and we randomly assigned service members and their supervisors to an experimental group or to a control group. We then took baseline measures of sleep, both with online surveys and with actigraphy devices. And then we implemented the intervention. And the intervention had two total worker health components. The first was a behavioral health leadership component. And this was really aimed to be more of a health protection, to have more of a health protection focus. And so what we were doing here is we were training leaders to not only support sleep, but also to support service members' family life and non-work life as well. And so that with that first component, we were really trying to target more of a health protection approach. And then the second arm of the intervention involved a service member health promotion approach. And so in this particular part of the intervention, what we did is we put actigraphs on service members and we tracked their sleep and we gave them some feedback. So after we did those intervention activities, we then collected data 4 months post-baseline just with online surveys around their sleep again. And then at 9 months, we were able to collect objective actigraphic measures of sleep in addition to, again, online survey measures of sleep as well. So let me tell you more about what the intervention looked like. So that first health protection component, we called behavioral health leadership, and it sort of targeted two different constructs. The first was sleep leadership. So here what we were trying to do is we were trying to teach supervisors through a 1-hour computer-based training to better support their service members' sleep needs. And so this involves checking in with service members, asking them how they're sleeping, seeing what workplace needs they have that would help them sleep better. And then also just training leaders on the importance of sleep for engaging in productive work and how they can actually engage in efforts to redesign the work environment so that service members can be getting better sleep on a consistent basis. And then the second thing we did is we also involved a component within the computer-based training that was focused on family supportive supervisor behaviors. And this really draws on some of Leslie Hammer's work where we train supervisors to show more care and concern around service members' family and non-work life. And so this involves behaviors like checking in with employees, providing emotional support around what's happening at home, helping employees on a day-to-day basis manage their schedules so they can attend to both work and non-work life, role modeling for employees, what it looks like to successfully manage both work and non-work life, and then engaging in some more proactive efforts within the organization to try and come up with new and creative ways for policies and practices to be redesigned so that employees' non-work lives can be better supported. Now, in addition, we worked with service members themselves and tracked their sleep. So what we did is we had service members wear these Philips Respironics actigraphs for 3 weeks at a time. And during those 3 weeks, we also had them doing some tracking of their own sleep or other events that may have impacted sleep. And when they brought the actigraphs back to us at the end of those 3 weeks, what we then did on site is we very quickly generated a report for them of their own sleep. This is just an example page of part of the report that we would print out for them. And then we had individual study team members sit down with each service member and actually walk them through their report of how they had slept over the last 3 weeks and what they could do to improve on their sleep duration, their sleep quality, and then also work with the individual service member to set some short-term behavioral goals for themselves around how to improve their sleep. And then we checked in with them a couple of weeks later to see how they were see how they were doing with their goal setting. And one thing to note is that these two intervention components, we worked really hard to try and integrate them. So they both had a big focus on the same sets of core principles. We were teaching supervisors about the same constructs that then we were including in the report for employees. And our hope was that we were truly yoking and integrating these two components in more of a total worker health approach than what has been done in the past. I also wanted to mention just briefly that we had a really unique National Guard sample that is a little different than other military samples that have been used. National Guard members in general are expected to protect domestic communities and support military forces overseas. They're often involved in very high-risk situations. For example, they were deployed during the 2020 armed insurrection. They're often called on for natural disaster relief, humanitarian emergencies, and are involved in overseas combat missions, meaning they're deployed. And then during COVID-19, many have been deployed to assist with healthcare and vaccine support throughout the state of Oregon and elsewhere. And also they're just called on and are employed in positions where they support the day-to-day functioning of the National Guard. So oftentimes when we think about the National Guard, many times we're thinking about people who are drilling just on the weekends. And our sample actually involves people who were employed full-time with the National Guard, with many who also drilled on the weekends. Now, one thing to note is that within the National Guard, there's both an Army branch and an Air Force branch as well. In terms of our participants and measures, I'll just quickly move through these, but we had a sample of 704 full-time service members within the Army and Air National Guard who were nested within 20 groups based on unit location. We measured a number of self-report sleep outcomes. We're currently working through our actigraphy data and hope to have those results to share soon too. So I'll give you a quick summary of the results. Interestingly, our intervention at 4 months improved self-reported sleep duration for service members. This effect did not hold up at 9 months though. What we also found at 4 months is that we improved sleep-related impairment. So self-reported cognitive functional impairments throughout the day that service members attributed to sleep. Again, didn't hold up at 9 months. We didn't find any significant effects on insomnia symptoms at either 4 or 9 months, but we did find that at 4 months and 9 months, employees reported less dissatisfaction with sleep. And then what I'm going to turn to now is just a quick summary of some of our interesting results where we actually looked at whether these results were improved in the Army versus the Air branches, whether that branch moderated these results. And so for the sake of time, I'll just share with you one of these. What we actually found is that if you look at just the Army sample on the left, as opposed to the Air sample on the right, the intervention group is in black, and then the control group is in gray. And what we found here is that the intervention was more effective in the Army branch than it was in the Air branch. And we found this across all of our sleep outcomes. Now, interestingly, one of the reasons why we think our intervention was more successful in the Army branch versus the Air branch is that at the time of the intervention, the Air National Guard was facing some extreme budgetary issues. And as a result, they were having really heavy workloads and experiencing a lot of stress. And so we just found that the intervention had a harder time there was less uptake of the intervention in the Air branch. So there were some interesting contextual effects here. But what we did find is that in the Army branch, we're seeing a difference of an average about 16 minutes more sleep per night. And if you notice, they're already sleeping fairly well, more than 7 hours. Now, 16 minutes might not seem a lot, and it actually is a small effect. But one thing to note is that the effect sizes that we're seeing are bigger than when we've done similar sleep interventions that just focused on health protection, but not necessarily health promotion. I'm going to zip through these and just move on to my conclusion for the sake of time. So what we found is that our total worker health intervention improved duration, impairment, and dissatisfaction 4 months later, with 9-month effects on dissatisfaction. Interestingly, we didn't find any effects on insomnia symptoms. It may be because insomnia symptoms are a harder sleep outcome to find change with, a little more clinical. And the intervention was particularly helpful for participants in the Army branch where there were fewer stressors and actually where more people work standard work schedules the Air National Guard is also subject to more non-standard work schedules that we think also was a challenge and obstacle for us in the Air Branch having good intervention uptake. Leslie Hammer recently published another study from these data and found that this intervention also improved job satisfaction, it reduced turnover, it reduced stress before bed, and personal and functional impairment was improved at 9 months post-baseline. So we're seeing effects beyond sleep as well. And so some future directions for us, we're working on the objective sleep data and actigraphic sleep outcomes, and we hope to have that information soon. We're also looking into whether the service member goal setting improved sleep. And then we're interested in supervisors and how they slept as well. And then we were lucky enough to gain some additional funding from the DoD to actually do some follow-up data collection during COVID. And so we're also trying to understand right now whether the intervention perhaps helped to buffer the effects of COVID over time. I lastly just wanted to point very quickly to Laura Punnett's work. And actually, Dr. Cavallari and Dr. Cherniak were also instrumental in this. I think we did a good job of improving upon some of the total worker health principles with our intervention study, but I think we still have farther to go. I think in future studies, we're really interested in addressing some of the more hazards and the more critical aspects of the work environment, like shift schedules and work overload that Punnett and colleagues talk about. We'd also like to have more worker engagement at later portions of the intervention that were involved just with the service members. And then we hope to also extend some of our mechanisms and outcomes to better understand how this intervention may have improved supervisor and employee relations, and then also if family sleep was affected as well. So I'll stop there. I've included my email address if you have any follow-up questions, and then also a link to our study website where you can learn more about the training and download some materials.